Welcome to the Hospital Finance Podcast, your go-to source for information and insights that can help you stay ahead of the challenges impacting healthcare finance. And now, the host of the Hospital Finance Podcast, Michael Passanante.
Hi, this is Mike Passanante, and welcome back to the award-winning Hospital Finance Podcast. Worksheet S10 has become an increasingly important part of uncompensated care reimbursement. To help us understand more about Worksheet S10, I'm joined by Jimmy Mendez, who is a senior manager on our reimbursement services team at BESLER. Jimmy, welcome back to the show.
Thank you, Mike. Good to be here.
Jimmy, why don't you start out by explaining why Worksheet S10 on the Medicare cost report has become so important?
Well, Mike, Worksheet S10 is critical to any facility that treats a high number of DSH patients. Any facility that has a DSH patient percentage over 15% is entitled to a portion of the uncompensated care pool. This uncompensated care pool is a set amount for fiscal year 2020 that CMS allocates to all eligible hospitals. The allocation percentage for each hospital is directly linked to the uncompensated care total reports on Worksheet S10.
Jimmy, what are some of the key data files that are needed to get started with the preparation of Worksheet S10?
Well, these include the following: 835 forms, 837 forms, age trial balance, detailed charges, general ledger and financial statements, insurance master, transaction code master, hospital service mapped by patient type, bad debt policies, charity policies, financial assistance policies, patient demographics, charge detail.
Which ones are the most critical, Jimmy?
The most critical are the transactions, which is the patient accounting transaction detail, the charge detail, and the patient demographics. Let's start with the patient accounting transaction detail. Essentially, you want a complete download of the patient accounting system. This will allow you to identify all of the transactions applied to a patient's account over the life of the patient's encounter. The payment transactions should be able to reconcile back to the 835, which are remittance advices, and the remittance advice can ID the patient responsibility. Transaction codes identifying primary, secondary, and tertiary pairs, as well as when the hospital started billing the patient and any charity care discount applied, are essential, as you want all components of activity, beginning with the total charges and ending with the patient's outstanding balance, to include reductions attributable to bad debts. It is also important to identify the service dates, financial class, and the GL department number and GL account number that each transaction hits, to ensure that you can reconcile the amounts to the general ledger accounts.
And you mentioned the charge detail. Can you elaborate on that critical file for us?
Sure. The charge detail is essentially a revenue and usage report that has exploded into transaction level by patient. It will contain data such as patient encounter number, revenue codes, charge amount, unique patient ID, GL department and account, service dates, patient type, patient class, among other items. The total should reconcile to your general ledger. In addition, utilizing the revenue codes, you should be able to identify physicians and other professional charges. These should reconcile to your 837s and should be excluded from S10.
And what information should the patient demographics contain?
This will include patient name, patient account number, unique ID, social security number, address, date of birth, medical record number, Medicare and Medicaid number, collection agency information, among various additional information. The importance of the patient demographics is the ability to identify the specific account and ensure that you have all of the correct information tied together from all of your data sources.
Jimmy, what are some of the issues that may arise that could taint the integrity of the supporting information, particularly during an audit?
Well, a big one is not having a well-written and defined charity policy that supports the patient detailed transaction charity write-offs. There is a risk that a write-off that is not supported by a charity policy will be deemed an administrative or courtesy write-off and will need to be excluded from Worksheet S10. Essentially, S10 should exclude courtesy allowances, discounts to patients not meeting the hospital's charity care policy, discounts given to uninsured patients not meeting the hospital's financial assistance policy, bad debt reimbursed by Medicare, and discounts given to patients for prompt payments. Other activity that needs to be addressed includes zero charge on write-offs, write-off amounts that exceeds patient responsibility or charges, and lack of a Social Security number.
And as you may have guessed from Jimmy's comments, S10 can be a bit tricky to prepare. If you're in a hospital and you need assistance preparing your S10, or if you'd like us to review the work that you've done on your S10, just drop us a line at update@BESLER.com. There's also some additional information on our website that you can visit. Just head on over to the Reimbursement Services webpage for that. Jimmy Mendez, thanks so much for joining us again today on the Hospital Finance Podcast.
Thank you, Mike.
This concludes today's episode of the Hospital Finance Podcast. For show notes and additional resources to help you protect and enhance revenue at your hospital, visit BESLER.com/podcasts. The Hospital Finance Podcast is a production of BESLER. Smart about revenue, tenacious about results.